I'm the best surgeon in the entire hospital, doing 240 high-risk surgeries a year, but getting paid only $10 per surgery. And the subsidy? Just $2,400, while our director, who never even steps into the OR, gets subsidies alone, totaling $1.2 million. So I announced right there at the department meeting. Starting today, I'm done hustling. I'm going full slacker mode, clocking out on time. The world doesn't stop for anyone. I want to see if the surgery department's going to shut down without you, Lin Haoran. But the next day, when director Wang Zhengguo faced a high-risk pancreatic duodenectomy, he totally panicked. Because this is one of the most complicated and highest-risk surgeries in general surgery. They call it the Mount Everest of surgeries. And in the entire department, nobody except me dares to do it solo. Right now, in the city hospital OR, the patient's bleeding out badly. No matter what Wang Zhengguo and his team try, they can't stop that damn bleeding point. Meanwhile, the patient's vitals keep dropping. The numbers on the monitor are like death's countdown. Every beep makes their hearts clench. This won't work. We're losing the patient. This bleeding point's position is too tricky. Only Dr. Lin can handle this. Lin Haoran. Lin Haoran again. Wang Zhengguo's screaming inside his head, but his face doesn't dare show it. He's glaring at the operating table with a dark expression, like he's trying to plug that hole with his eyes. But reality's brutal. Director, call Dr. Lin. It'll be too late if we wait any longer, so he pulls out his phone, fingers trembling as he finds my number. But the moment he hits call, sorry, the number you have dialed is turned off. He actually dares to turn off his phone. Wang Zhengguo is so mad he almost smashes his phone. But he doesn't give up. Tries the office landline, busy signal. Then he remembers, I unplugged that landline ages ago. Useless, all of you useless. Wang Zhengguo's in the hallway, losing it, yelling at Liu Bing. But Liu Bing keeps his head down, not daring to say a word. In the end, Wang Zhengguo has no choice but to activate the emergency protocol, dragging all attending level doctors out of their beds. For emergency consultation and rescue, several senior attendings rush over, looking at this mess, just shaking their heads. Finally, after everyone working together half the night, they barely managed to stop the bleeding and save the patient's life. But the surgery's a total disaster. What could have been minimally invasive now ended up with a massive incision and serious complications. Meanwhile, I stroll into the office at 8:30 a.m. right on time, nice and easy. At the same time, the department's a total mess. The hallway's packed with patient families, crying, cursing, arguing, complete chaos. Young doctors trapped in the middle, totally helpless, and I just tune it all out, walk straight into my office. Grab my thermos, toss in some goji berries, some chrysanthemums, pour hot water over it. But right then, Wang Zhengguo with two massive dark circles slams open my office door. Why didn't you answer last night? Why was your phone off? Do you even care about the team? Do you care if patients live or die? A string of accusations, all from his moral high ground. But I just casually blow on my tea, take a slow sip. Only after I set down my cup do I look up at him. Director Wang, I clocked out right at 5 p.m. yesterday. According to regulations, after work hours are my personal time. I'm off duty. As for the phone, my cell died. The landline probably had a fault. That's all normal. Plus my subsidies, $2,400 a year. $10 per surgery. To provide you with 24/7 on-call service. Director Wang, do you really think that's fair? Fine, Lin Haoran, you just wait. I'm reporting you to the hospital, docking your pay. Docking your bonus, go ahead. It's not much anyway. I stopped looking at him. Finally, he stomps his foot hard, turns and storms out. And now without me, the department is like a car missing its core engine, creaking and groaning, ready to fall apart any second. The last surgical accident cost Wang Zhengguo a fortune, just to barely settle with the family. But the malpractice record is like a shameful brand burned into the department files. Today another tricky case comes in. Abdominal aortic aneurysm, huge, and it's right up against the renal artery. Insanely high risk. If this thing ruptures, the patient will die within minutes from massive hemorrhage. Wang Zhengguo urgently calls all attending physicians for consultation. The attendings look at the CT scan, all looking grim, frowning hard. This aneurysm's too big, bad location too. Easy to damage the renal artery during dissection. Yeah, and blood pressure control during surgery is a huge problem. Risks too high. This kind of surgery, wasn't Dr. Lin always the lead surgeon? Someone mutters quietly. Everyone's eyes unconsciously drift to Wang Zhengguo. Wang Zhengguo's face goes red, then white. Then he grits his teeth and tells Liu Bing reluctantly, this surgery, you're doing it. Director, I really can't. I still haven't resolved my last malpractice case. I can't touch this. In the end, Wang Zhengguo has no choice but to pick the most pathetic option, conservative treatment. Everyone knows this so-called conservative treatment is just buying time, waiting for death, because that abdominal aortic aneurysm is like a ticking time bomb, ready to explode inside the patient any moment. The whole department's in panic mode. Everyone's got sharp eyes for spotting trouble, and the department's skill level. They all know the truth. Meanwhile, some patients with connections, after hearing the situation, start transferring to other hospitals, going elsewhere, and the surgery department's beds have massive vacancies for the first time. Surgery volume and quality drop off a cliff. This month's bonus is definitely toast, so complaints behind closed doors start popping up everywhere. But this time the target isn't me. It's Wang Zhengguo and Liu Bing. Meanwhile, Zhao Qian, like a little spy, comes running to me all worried. Dr. Lin, everyone's trashing Director Wang now, saying he's an incompetent boss ruining the department. Some even say they shouldn't have joined the mob and driven you away. If they'd known, they wouldn't have. When the avalanche comes, not a single snowflake is innocent. Some Ainudia has half understanding. After that, Wang Zhengguo sees threats don't work. so he tries sweet talk. At the weekly meeting, he suddenly praises me, Comrade Lin Horan. Although your work enthusiasm's dropped lately, your technical skills, we must acknowledge. I'm nominating you to the hospital for Employee of the Year. Everyone applause, sparse clapping. But everyone's face screams awkward. This flattery tactic is way too obvious. Right now, everyone's watching me, waiting to see my move. Thanks for the thought, Director. But right now, I just want to be a slacker and enjoy life. This Employee of the Year honor, give it to someone who needs it more, like Deputy Director Liu Bing. Wang Zhengguo gets shut down publicly again, speechless with rage. All his schemes, whether threats or bribes, fail completely on me, without me as the backbone. The surgery department's operations practically grind to a halt. Complaints and disputes everywhere. Hospital leadership starts calling Wang Zhengguo in constantly. His director position, earned by sucking up in seniority, is starting to crumble, while I clock in and out on time, living my best life. This afternoon, a red flag sedan with special red plates ignores the authorized personnel only sign and drives straight to the inpatient building. I don't recognize that plate, but just from the vibe, you know whoever's inside is a VIP. Next thing, the hospital director, deputy director, admin office, medical affairs, the whole leadership team practically sprints out of the admin building, with nervous, flattering smiles rushing to the car, standing in a respectful line, while at the department windows, heads crowd to watch the show. What kind of big shot is this? Even the director himself came out. That plate looks like provincial level. As the car door opens, several guys in black suits, with serious faces step out first. Then a gray-haired but sharp-looking man, with help from others, slowly exits, then he's rushed into our surgery department's VIP ward. The whole department's atmosphere goes super tense instantly. The preliminary diagnosis hits like lightning. On Wang Zhengguo's head, giant pheochromocytoma with acute heart failure. This is an extremely rare and dangerous disease. The tumor randomly secretes massive hormones, causing wild blood pressure swings. During surgery, it easily triggers malignant hypertension, dangerous, heart failure, brain hemorrhage, mortality rate over 70%. Then, all the hospital's top experts are urgently called to surgery for consultation. In the conference room, all the attendings shake their heads at the CT scan. Too tricky, the tumor's wrapped around the adrenal gland, and all the major blood vessels around it. There's no surgical space. Exactly. Plus, the patient's old and has heart failure, can't handle such major surgical trauma. This surgery, nobody in our hospital dares touch it. Risks too high, extremely dangerous.